Up until a few months ago, most Grenadians had not heard of the Zika virus in Uganda or the virus that bears this region's name. Also laid to rest was the chickenpox virus until now. Many didn't know the word chikungunya until it hit our shores in 2014. Today, news of these infectious diseases and so many others are spreading across the country, sparking fear and concern. The Ministry of Health and other agencies are busy looking at containment measures to avoid an epidemic. But Professor in the Department of Public Health, Martin Ford, using this analogy says viruses can be easily spread, particularly those carried by the Aedes aegypti mosquito.
You go off on an assignment, let's say, to Brazil to cover the Olympics. You're happy. You get bitten, you get infected, you come back here. You could be infected and you don't even know. Because with Zika, 80% of people don't get symptoms, but doesn't mean you can't spread it. You get bitten now by a Grenadian Aedes aegypti mosquito who is not infected. She gets infected, it's only Finn. Bites your colleague here, Eugenia. Then it goes and bites everybody up in GBN. You all go all across the island covering stories here, there. You go into the school to find out about the chickenpox. Mosquito there bites some child. The child goes home. You see how easy? It's like a wildfire.
Professor Ford says the emergence of these viruses and diseases point to two important factors which should be considered: the need for vaccination, but more importantly, that of maintaining a clean environment.
It says that we have to be very cognizant of the way we live, the practices that we practice, and pay attention to our environment. The more we interfere with it, typically when man interferes with the environment, is not an improvement. There are always unintended consequences. Then it comes back to bite us, no pun intended, or maybe pun is intended. Literally, what we do to the environment will affect us. And so we need to be more respectful and cognizant that what we do can have an impact, if not immediately, eventually on our health.
Yesterday, St. Vincent became the latest CARICOM country to record its first case of the mosquito-borne Zika virus. Last week, a 61-year-old woman was confirmed as the first Zika case in Trinidad and Tobago. Eugenia Peters, GBN News.